California, and by special request, I am going to talk about PCOS and GLP-1s. So, really quick background, PCOS, for those of you who don't know, stands for polycystic ovarian syndrome. It's diagnosed by someone having two of these three diagnostic criteria. So one is cysts all over the ovaries when we do an ultrasound. Two is hyperandrogenism, which means you're making more androgens than is normal, and that can manifest as facial hair in places, more hair than usual, not just a couple little whiskers. Or acne. And then three is really irregular periods. So you're having periods all over the place or not at all. Those are considered diagnostic. We diagnose it by a constellation of symptoms. So what we see in PCOS, we used to think of PCOS as kind of like everyone was overweight and infertile and you could help them by getting them to lose weight. So now we know that there can be people who can have PCOS and be slender. People can have PCOS and have babies. But, a good majority of people with PCOS do have some level of insulin resistance. And so it can be very, very difficult for them to lose weight. Enter GLP-1s. And so I know, they're really big right now, really famous, but physicians have been prescribing GLP-1s for years. And, not just Ozempic and the newer ones, but like older ones too. I mean, I think Byetta was one like 20 years ago. We've been using them for years. And a lot of OB-GYNs have been using them in their patients with PCOS, but now it's becoming even more to the forefront. I think especially as it's become famous for weight loss, people who are struggling with their weight who have PCOS